Assalamualaikum. Another clinical abdomen station, Wilson may come. So it may be please do the para-abdomen examination. So if it is the case of para-abdomen examination, what can we find? We can find that in the general, as a part of the para-abdomen examination, whenever we start with the examining the hand or look overall the body, there may be the patient may be icteric, and there may be other features such as in the general examination in the eye. Actually, it's not possible to every time. It's not possible to find the KF Kessler Fleischer ring in the eye, but sometimes it is visible. What is it? It is the greenish brown ring due to copper deposition in the deciment membrane of the sclerocorneal junction. Sometimes sunflower cataract may be found. Patient may be anemic, rickets may present, may have the features of arthritis. And in the para-abdomen examination, there may be features of chronic liver disease, portal hypertension, ascites. And here we have to do the neurological examination. Or to complete my para-abdomen examination, I want to also do the nervous system examination. Here the findings may be tremor, dysarthria, drooling, psychiatric manifestation, dementia, deterioration of the handwriting, speech disturbance. So how will you diagnose? Diagnosis, to establish the diagnosis, serum ceruloplasmin, urinary copper excretion, and deep penicillamine challenge test. In where I am expecting serum ceruloplasmin may reduce 24-hour urinary copper will more than 100 microgram, and deep penicillamine challenge test, patient have to take 2 penicillamine 12 hourly for 1 day, and during this period all urine has to be collected in a jar for copper estimation. If the urinary copper excretion more than 1600 in 24 hours, then it is suggestive of Wilson disease. And other supportive tests, there may be hemoglobin may be reduced, features of hemolytic anemia may present, liver function test is serum bilirubin SGPT increased, prothrombin time may be increased, and MRI of the brain, there may be reveals changes in the basal ganglia, genetic test and genetic screening for the other members, and liver biopsy, where we can found that liver content found in liver biopsy more than 250 microgram per gram of weight of the liver. Now the management by MDT, multidisciplinary team management. I will take the focus history, review his previous note, and I will involve the multidisciplinary team: pediatrician, neurologist, hepatologist, dietitian, nephrologist, genetist, ophthalmologist, speech and language therapist, and liaise with school. And supportive therapy, deep penicillamine, who can tolerate deep penicillamine, antiurine hydrochloride may be given. And to decrease and we can provide that zinc acetate. It will help to reduce copper absorption, and we should not give zinc to give at the same time of copper chelation. Pyridoxine can be given with the penicillamine because penicillamine may cause optic neuritis, and this copper chelator and zinc have to be continued through a lifelong. And dietary advice: low copper containing diet, shellfish, chocolate should be avoided, and specific is liver transplantation, and prognosis, poor prognosis for the untreated Wilson disease. And the main pathophysiology, if it is come in the communication, that in Wilson disease, because of mutation of ATP7 gene, which is helps in incorporation of copper into ceruloplasmin, and thus decrease the excretion and that increase the copper excretion from the body. As there is mutation of this gene, so there is impaired incorporation of copper to ceruloplasmin by the liver, and thus decrease the secretion of ceruloplasmin in blood and decrease excretion of copper into bile. For this reason, the copper restoration in the body is increased and it is deposited in the brain, and copper induced toxic injury to the RBS, basal ganglia, cornea, kidney, bones, joint and parathyroid. Thank you. Assalamu alaikum.